we have a number of very excellent questions that all of you have submitted. I'm going to ask these questions, and Dr. Newman will provide the answer. So, Dr. Newman, why don't you come and join me up here? All right. The first question that has been asked is, Dr. Newman, what you have discussed is the stem cell lift. Can you correlate that with the product Luminesce?
The stem cell lift, basically, we're using true stem cells, the cells themselves. So we're taking the cells from the fat, separating it out, and then injecting it back into the body. The cells are producing what is in Luminesce, but there's no cells in Luminesce. Does that make sense? Yes. Okay. So in the laboratory, we grow the stem cells, and we get the language that we talked about, and we bottle it. In the body, they're producing it naturally, and that's how it works. Now, a lot of times I tell my patients to use Luminesce in conjunction with the stem cell lift because they'll see a faster result, they see better results, the skin gets better, so that's how they correlate. And the main thing to understand is that there's no live cells within the Luminesce.
Thank you. Can you discuss further if there are studies showing the effects of Luminesce to substantiate the results that we are seeing?
I don't know if you remember when I showed the slides with the percentages. That was actually a study that was done on the product, and that study was basically showing how people who use the product under controlled circumstances benefited from the product. If you want scientific studies in terms of biopsies and looking at it under the microscope, it's hard to do in a cosmetic setting because how many of you are willing to have a scar on your face? So I can't do it. I mean, I can do it and put it on their arms and then, but for cosmetic reasons, most people are not willing to have a scar. So I don't look at it under the microscope for Luminesce in terms of the cosmetic end. But if you look at it for the other things that we've done for wound healing, there's a lot of data for the stem cells. So there's a lot of data out there, but not on the product for cosmetic just by itself. But if you look at it in terms of objectively, looking at it, which is what they did, and doing a clinical study and not a basic science study, not looking under the microscope, by looking at the skin, looking with magnifiers, that's what the result is.
In the KABC video, the results of your stem cell lift are very dramatic. Can we say that the same technology is what makes Luminesce such a powerful product?
Yes, absolutely. It's the same technology. It's the stem cells that are doing the rejuvenation. The difference is when I'm doing the procedure, I'm also giving volume. So I'm putting fat, and that's giving you a volume. Luminesce is not going to give you volume. It's not going to make you plump up like that. But it's going to talk to your cells to renew themselves, to make your lines better. It's going to make your skin smoother. It's going to take away some of the damage over the years that has come just through aging or through lifestyle or through sun exposure. Is going to reverse some of that. So that's the same process that's going on when you put on Luminesce on your skin. Is going to be telling your skin, make new collagen, make new elastin, make new blood vessels, so that it's youthful. But when you're putting the fat in, it's giving you the volume, and then that's the major difference between just putting the product on versus if you're doing the surgical injections.
Anti-aging products are very popular with people in the baby boom generation. If younger people in their 20s and 30s, for example, use Luminesce before wrinkles